Let's go live to Riverdale Park. This is where mayoral candidate Mark Saunders is making an announcement about mental health and addictions.
First-hand experience in recovery. I'll convene a summit with all levels of government on addressing gaps in existing mental health services. We need to make sure that people have access 24 hours a day. I'll develop a wraparound services strategy that recognizes care should be integrated between the city and Toronto Public Health and service providers, so no one falls through the cracks. And I'll establish a clear agency accountability for those seeking services and support. And last, I'll increase the number of mobile crisis response teams to provide more consistent and around-the-clock response. When it comes to helping those struggling with addiction, I will focus on treatment and rehabilitation. I'll do so by providing nonprofits with free space in unused city-owned buildings. This will help nonprofits deliver addiction services, get the right affordable space that they need. Nonprofits can then use rent savings to provide more help for more people. And I'll earmark a set number of spaces for emergency referrals from city agencies like police and paramedic service in return for the space. And when we work to increase services and supports, we also need to build workforce and infrastructure. We will need more people to help. As mayor, I will call on the province to waive tuition fees for the next 3 years for Torontonians looking to train as mental health, addiction, and supportive housing workers. I'll hire up to 100 of those grads. I'll hire additional public health nurses and negotiate with builders of new rental buildings to include supportive units in their projects and provide them to nonprofits to operate their own programs. Make no mistake, we need a fully integrated, all-hands-on-deck approach. As a former police chief, I know what needs to be done. I will roll up my sleeves and get to work right away. Let's protect Toronto's future. Thank you very much. And I'll now take any questions if anyone has any.
Mr. Saunders, so because you're a former police chief, everybody's going to be looking at your plan and sort of evaluating how much of it is enforcement versus how much of it is the compassion you talked about. So can you tell me about how you decided on the balance? Because people would expect a former police chief to probably to lean more on the enforcement side.
Yeah, thank you for that question. So, anyone that followed my journey as the leader of the Toronto Police Service, I made it very, very clear that we can't arrest our way through this. This is a health issue. Whenever you have law enforcement first responding to a health issue, that speaks to a failure in the system. And the other thing, which is really key and critical, throughout my years and even to present day, there is no help or support after 5 p.m. or before 9 a.m. These are crucial moments because during those time frames, it's either law enforcement or it's emergency. And we know that's not a sustainable solution. And we're seeing an increase of people that are in need of help when it comes to living with mental health or suffering with addiction. By doing it this way, by having the right resources in the right places at the right time, by enhancing locations other than hospitals or incarceration, I think that we'll be moving our city in the right direction. It'll be healthier, it'll be sound, and it'll be the best approach.
And some of those things like offering city building space to nonprofits who help, I think already happened. So I'm just trying to figure out how it's different. I know sisterings and other places usually avail themselves of property and recreation centers or other things. How would it be different for you?
Well, first off, it's 24/7. I think what we need to do is understand that the capacity issue has to be continuous. Mental health is 24 hours a day. Addiction is 24 hours a day. By shutting down most of the resources during those times, that's when we start to have issues. Making sure that the supports are there at the right time, at the right place, by having more outward-facing resources as well to assist in this process, I think will yield exactly what we're looking for, which is a healthier city, which is to add some dignity to people that are in need of help, but also putting the right solutions in the right place and not just throwing more money into a system that isn't the best way of going about doing business.
And you know that the city and the Toronto Police are trying to have mental health crisis workers go sometimes when somebody doesn't appear to be a threat to others or maybe themselves, instead of a traditional police response,
Yeah.
which sometimes has yielded deadly results.
Yeah.
As mayor, would you change that, accelerate it, decrease it? What would your
Yeah.
feelings be about that?
Well, as I stated, that would be enhanced. I helped develop the mobile crisis intervention teams. It is so critical because then it reduces the 911 calls, and it also helps maintain the treatment and keeping an eye on people that are in need and help. Not everybody has family to help and assist, and I find more times than not, if we have these agencies going to those people instead of waiting for something to happen, we get better results, and we know that it's more cost affordable as well.
And my last question is that I think you know that there was some criticism when there was a picture of you and 32 division officers saying, are you mixing politics and policing, including Alak Mukherjee, who you know well, wrote a blog post saying it showed poor judgment. And I think some people reference a situation where Bill Blair was photographed, I think, with you and got some criticism. Can you explain the circumstances of that, and did you make a mistake?
Yeah, absolutely. Well, first off, there's never an issue for me going to the police station where I reside. It's important to have relationships with law enforcement, and I recognize the great work that they do. Secondly, listen, as a leader, you're going to be scrutinized, and I think that's one of the things that separates me from the other candidates. I've actually been the leader, the head of the largest policing agency in Canada. And with that come good things and things that are questionable and challenging. It's about the ability of learning, and I've learned quite a bit when it comes to the leadership piece, but make no mistake, I'm not going to get distracted. I'm running to be the mayor of the city of Toronto. I come with good policy and I come with good plans. It's important that we move our city in a proper direction right now, and I want to be at that table to make sure that that happens. And today, when we speak about people that live with mental health, and we speak about people that are suffering from addiction, I think that this speaks for itself on how we make a better, healthier city, and I'm looking forward to the opportunity.
So when some people say it appears that you want it to look like police officers are endorsing you, you don't do that?
No, that was not the intent in any way, shape, or form. I wasn't handing out any literature. As a candidate running for mayor, I'm going to be all over the place. I've gone north, south, east, and west. In a lot of places, actually, where mayors have never been, and they're excited to see that I'm there and that I'm representing them. This is about hearing all voices, and as we move forward, I look forward to using that as one of the things that I think is key and critical, that I'll listen to everybody when it comes to what needs to be done to make the city a healthy city, a vibrant city, and a city that we all will be proud of.
We had 3 new opinion polls for whatever they're worth over the last few days, all showing Olivia Chow with a pretty healthy lead, and then you in second or tied for second. What do you have to do to beat Olivia Chow between now and June 26th?
Well, I think as more people read her platform and realize if they think that affordability is an issue, it will be a huge issue if Olivia Chow is going to be mayor. Her history speaks for herself, her policies speak for herself, and I'm looking forward to having those debates and really pulling out exactly what the tax plan is and how much tax, it's not a matter of if, but how much tax the city is going to have to undergo under her leadership.
I guess it just begs the question, you're talking about enhancements today, but the city has less than no money, about $1 billion less than no money. I still struggle with you and almost pretty much all the main candidates to understand how you're going to pay for any of your promises. Everybody says, well, I'll get the federal and provincial governments to cough up, but so far they aren't.
No, my plan is always, first and foremost, what can I do? And the first thing that I will do is I will be looking at the books in detail to see where money is going, because to be quite frank, I don't think money is going in the right direction, which is one of the reasons why I'm running for mayor. Once I have a look at those books and figure out exactly what's going to be prioritized, and I'm always going to prioritize people first, looking at from there what we need to do, what we need to develop, creating the right partnerships with all levels of government and with the private sector to see what we need to do to make a healthy, vibrant city of Toronto. And trust me, when you prioritize, it will get done and it will be paid for. And my priority will always be people, will always be building more houses, affordable units so people can move into the city, and also have the opportunity of creating great jobs.
Great. Thank you.
Okay. Thank you very much, everyone.
And with that, we've been listening to mayoral candidate Mark Saunders at Riverdale Park announcing his plans to address mental health and addictions, including a summit to address the gaps in mental health.